Thank you. I appreciate the opportunity to come and talk to you a little bit about genetic evaluation from the perspective of pulmonary hypertension. Most of this presentation will be off of information that either Dr. Holt or myself or Dr. Spidell have developed. We're kind of the key group as far as this particular presentation, but we've got a whole host of different people that have been involved and really intricately contributing to our research in pulmonary hypertension. And I'm sure I've already seen a number of names I've left off this. Some of these are past grad students, current grad students, postdocs. I'll show you a slide later on from Rebecca Cockram, who was a PhD postdoc for us, and some work she did, and I noticed I don't have her name on here. So a whole team that's working on this, but really when we start to think about how is there an opportunity to select animals so that we reduce the incidence of pulmonary hypertension and death loss both at high elevation and in the feedlot, and Dr. Spidell will talk a little bit more about the feedlot aspect of it coming up. But when we start to think about how we develop selection tools, really we're looking at answering some questions in the process of developing ultimately PAP-EPD. In this case, is there genetic variability in the trait? What are the environmental influences on that on that phenotype, the things that we're actually measuring, and how should we really construct contemporary groups? And then in cases where we have sparse data, and we could argue that PAP and pulmonary hypertension is one of those areas, what are some correlated traits that we could actually leverage to generate more information and make a better genetic prediction, and then ultimately interpret the resulting EPD? And so Dr. Holt covered this a lot. You know, he said in his talk that originally pulmonary hypertension and high mountain disease or brisket disease occurred at about over 6,500 feet. Now we're seeing it over 5,000 feet. And then, of course, the bovine congestive heart failure at lower elevations. But no matter what, we get increased death loss. And so in the context of this, at least in high mountain disease, it's a function of the fact that as we go up in elevation, there are lower percentages of available oxygen. And I borrowed this slide from Dr. Milt Thomas, who put that together. But essentially, if you look at cattle at sea level, the Gulf Coast or pick your favorite sea level spot, and you move those cattle to 10,000 feet of elevation, we've got about 70% of the available oxygen at that elevation. That puts the stress on. We've got alveolar hypoxia, and we go on with what Dr. Holt described in his flow chart of what happens in that context. Okay, so really our goal in developing PAP-EPD was to give breeders a tool to select animals that are less susceptible to pulmonary hypertension and ultimately the probability of a death and of course the economic consequences of that. So going back to that first slide, one of the things we want to determine is there genetic variability associated with the trait? And so heritability is one of those indicators, or tells us how much of what we observe is actually due to underlying genetics. And we've had a whole host of grad students and postdocs come through and do a variety of estimates, but if you look at this, we've got heritabilities that range from what, 0.25 I think on here, all the way up to 46%. Okay, so what we're starting to see then is there is genetic contribution to overall pulmonary hypertension. And if we put that in perspective, here are some of the traits, heritabilities that I took from a review paper related to the other traits that we normally make selection decisions on. Okay? And if you look at that in the context of what we already have EPD for, the genetic variability in pulmonary arterial pressure is in the same realm. Right? So we have enough variability in our populations to make selection decisions if we have the right tool to improve pulmonary hypertension, pulmonary arterial pressure. So we know that the trait has a large genetic influence. Okay? So our next step as we develop these is to look at what are the environmental or non-genetic factors that actually influence the observation, when we're thinking about pulmonary arterial pressure, that Dr. Holt takes or another veterinarian takes. And there's a whole host of those. Brian talked about ionophores. Ionophores we know will elevate pulmonary arterial pressure. And if you get a huge dose of an ionophore above recommended, it can cause heart failure. right? So we know that occurs. We also know that parasite load has an influence on it. We know that respiratory disease or anything that damages lung function is going to influence, right, that observation that we get when the veterinarian's there to take a pulmonary arterial pressure. And so we also know, based on our research, that as you move up in elevation, the average pulmonary arterial pressure increases as well. So that's something that we need to adjust out. Much like when you submit weaning weight observations, you wean on the same day or the same couple of days. The calves aren't all the same age, so we adjust that out when we do a weaning weight EPD. We need to do the same thing when we start to think about pulmonary arterial pressure EPDs. Body condition and fat thickness has an influence. There are breed differences, and we'll talk about those a little bit later on. But in the context of what we typically have done for pulmonary arterial pressure is we've started to lump those to try to develop good contemporary groups where the animals that are in a contemporary group have really competed head-to-head. They've had the same opportunity to express genetic differences. So we look at it now as we construct pulmonary arterial pressure EPD. What day was the PAP observation taken on? Hey, we know weather, especially cold, has an influence on that measurement. Okay, so this puts them on the same footing when we start to take those measures. We look at elevation on the same day, or the ranch. Typically you don't move locations within a ranch on the same day to take pulmonary arterial pressures, the sex of the animal, and the technician effect. Hey, we've lumped that all when we do these EPDs and the EPD development into what we call a contemporary group because it really puts animals competing head to head. Then we look for adjustments for age. I've already touched on that. Breed composition, depending upon the data set that we're working with, looking at what are the differences in the foundational breeds, and then heterosis and the effects of heterosis. We know in the context of our research that heterosis has a favorable effect on pulmonary arterial pressure, much like it does for many of the other traits for which we produce EPDs. And then in the context of that other bullet, relative to how can we get more information, typically, years ago, Dr. Holt didn't want to PAP anything below 6,000 feet, right? And then we started looking at what is the pulmonary arterial pressure at lower elevations. And what we've done then is start to look at those lower elevation pulmonary arterial pressures, or I'll call it moderate elevation, and what influence it has with all of the historical information we have at high elevation. And we're starting to think about what data can I leverage? How can I get more information to get an EPD that's going to give a better prediction of the susceptibility to pulmonary hypertension? And so we've had a couple different grad students, and then Dr. Spidell did some work in looking at what is the relationship of this lower elevation, moderate elevation pulmonary arterial pressure and the higher elevation pulmonary arterial pressures, because we know things have changed. And so in both of these studies, one of our graduate students looked at this from the standpoint of 5,500 feet and above, another one looked at 5,250. And if you look at that, what I've got in blue boxes is the heritability of pulmonary arterial pressure at those elevations, in those groups, okay? But if we're going to leverage that, and really most of our historical data is on the higher elevation, what we need to do is look at those genetic correlations, okay? And the genetic correlations in both of those studies are in the range of 0.8, okay? What that says is, okay, as we develop a prediction tool, right, many of you will go out and you'll ultrasound your breeding animals. That goes into the genetic evaluation on breeding animals for our prediction of carcass merit genetics. Right? That's how we get the carcass merit EPD. This is the same, right? This is very much similar as far as the genetic relationships when you ultrasound breeding animals to make a prediction of how their progeny should perform in the feedlot, or at harvest, at harvest. Okay, so this says we can start to use moderate elevation to improve our accuracy and actually make predictions at higher elevation. And if we look at this, Dr. Spidell actually took a newer technology and looked at if we take a huge range of elevations of PAP, right, and how could we use that in a genetic prediction? And you start to see it's called a heat map. As long as we're similar or pretty close to the genetic, the elevations, we can use multiple observations from a lower to a higher elevation, and only do we lose that genetic relationship, and it becomes less valuable when we get at the extremes of these. right? At the very extremes where we have really low elevation versus really high elevation, right? So, but the rest of the information we can actually use and leverage to make genetic improvement and produce a better EPD. Okay, so realistically, we've worked with 4 different groups. One of them is our own group, so I put that on there, the Beef Improvement Center. But we worked with IGS, American Simmental. You all have a prototype or a second generation prototype for pulmonary arterial pressure. American Angus Association. We've worked with Leachman Cattle of Colorado, and then our own research facility, which is located at about 7,400 feet of elevation. And we use that facility, just a little bit of background, to work with some of the semen companies to progeny test animals so they know what genetics they're able to market into higher elevations and not worry about increased death loss in those offspring. So a lot of our work, our basic historical work, has been built on that bottom one, the Beef Improvement Center. Okay, but what I want to do is pull apart kind of how similar some of the genetic evaluations actually are for this particular trait. Okay, so on the left side, I've got the American Simmental / IGS genetic evaluation. On the right side, I've got the American Angus Association genetic evaluation. I pulled off some of their information from the website here the last couple days ago. But if you look at this, and what I really want to highlight in all of this is the difference in the genetic variability of the EPDs. Right? If you look on, the left side, the difference is 15.5 millimeters of mercury. If you look on the right side in the American Angus evaluations, about 14.2 millimeters of mercury. Okay? So there's a fair bit of genetic difference in what we would expect in the progeny of those. And talking to Dr. Holt on the way down here, I think the animals he papped were at 36 or 37 millimeters of mercury. If you assume those were the best, and they're going to produce progeny, and they were the best versus the worst, you're going to get about a 15 millimeter mercury or spread in pulmonary arterial pressure. Okay? And that has a huge difference on whether the animal is suitable or for production at higher elevation. Okay? Now, in the IGS prototype, we've actually included 4 different breeds in that genetic evaluation to give us that string or that range in pulmonary arterial pressure, and our accuracy in the last evaluation, I think the maximum was 0.74. Okay? And that gives you just a distribution of the different breeds that are involved in that. But ultimately, when it gets to the breeders and our constituency, it's how do I use that? Okay? And it's an EPD. All of you are used to using EPDs, and you just take the difference. Okay? And so this is a bit of a very rudimentary review. Okay? But this leads us to something else, because PAP is a unique trait where it's not just always the EPD we're concerned about in the genetics it passes on. So we're going to use this. If we took these 2 different sires, I pulled them out of the last IGS analysis and said, what if we looked at breeding both of those? And on average, we know the offspring are going to average by about 2 millimeters of mercury difference on average, assuming you're mating them to the same genetic merit females, right? Give them a fair chance, right? You're not specifically non-random mating, best to best, worst to worst, whatever the case may be, okay? So the question then becomes, and this is where pulmonary arterial pressure is a bit of a unique trait, because you need to interpret that. This is a new EPD in the context of where the herd is currently and how that genetics will be used. Okay, so it comes to 2 questions really. The questions are, given the nature of your cow herd, has it been selected, has it been stressed, right, if you will, for pulmonary hypertension? So we're starting to think about, you've got a history of maybe having that high altitude challenge, or you've traced cattle on through the feedlot. We know they may have some pulmonary hypertension problems. Okay? So the first question is, which animals will produce, when we think about PAP EPD, which animals will produce the next generation of calves that have acceptable PAP? So we're looking at EPD from the standpoint of what happens in the next generation. But if you're purchasing an animal as opposed to purchasing semen or embryos, we need to look at what will survive at high elevation. So I go to a bull sale, I buy a bull, right? And I want to move it to 8,000 feet of elevation at our research facility. right? But I've bought this bull at 5,000 feet, right? So we need some idea, will that bull actually survive at the higher elevation? That's our second question, because we know, right, that there are a whole host of environmental factors that can elevate a PAP score, right, that are non-genetic. But the animal still has to survive at elevation if you're purchasing seed stock and moving them to elevation. And so if the animal itself is going to reside at elevation, that phenotypic measurement that your veterinarian gives you, or at the bull sale you're at, you look at the phenotypic PAP, is relevant, right? Because if you move the animal to higher elevation, it has to survive at high elevation. Okay, we're still worried about its PAP EPD as well, because that's what it's going to pass to the next generation and influence their performance. Whereas if you're looking at just purchasing semen, we're really only worried about the PAP EPD, because the individual animal itself doesn't need to survive at elevation. So interpreting and using PAP EPD is really different than many of our other traits. We're really worried about, especially animals residing at elevation, whether they have an acceptable phenotype in addition to an acceptable PAP EPD. So it's a bit of an added challenge in that. And so what we've done in concert with Dr. Holt is actually develop a number of different guidelines that tell you whether a bull is high risk, low risk, depending upon where that bull or that female you purchased is actually going to reside. And these are all published on the Beef Improvement Federation website. Okay, but this example says, well, what if I papped at what we would consider a moderate elevation? 4,000 to 5,000 feet. Okay, so that's in our title right here. Okay, and so what about their PAP scores that Dr. Holt or another veterinarian actually put on these particular animals when I go to the sale? What's their phenotype? And where am I going to move those animals after I purchase them? Okay, and so if you're going above 7,500 feet and the animal papped 46 to 49 at 4,000 feet, that's not something you want to move to high elevation. It's a high-risk animal, and the recommendation would be not to use that at high elevation. Okay? And this is just a small snapshot. I think we have 6 of these for various elevations where the PAP was measured, and they're available through the Beef Improvement Federation website. But this really becomes important in addition to the EPD when we start to think about what animals are going to reside at elevation and where are they actually going to be used. Some other relevant information, okay, what we do at CSU to try to expand the amount of data is every 2 years we hold a training session for veterinarians called the PAP Summit, and we invite veterinarians to come in, retrain to make sure we're getting appropriate pulmonary arterial pressure measurements. Dr. Holt leads that training session, and then Dr. Spidell, myself, and other scientists present some of the latest research associated with that. Okay? And so just make you aware of that. I think our next one is next August. If you have a veterinarian or you happen to be one who would be interested in participating in that, it's a two-day program and you get continuing education credits. Okay? Some of the other things I'd like you to consider as we talk about pulmonary hypertension, the best approach to including more data, really our research says we can leverage some moderate elevation pulmonary arterial pressure phenotypes to make prediction about high elevation susceptibility and pulmonary arterial pressure. And so that's where we're really expanding some of our information. And Dr. Spidell in the next talk will talk about some of the PAPs at moderate elevation feedlots. Our research relative to high altitude pulmonary arterial pressure would show that it's a very polygenic trait. And so we're going down the road looking at our research data as far as identifying the best set of markers that give us the highest accuracy pulmonary arterial pressure EPD. And so that's really where our work is right now, is how can we utilize genomic information to up the accuracy of our pulmonary arterial pressure EPD and give you as breeders better tools to select against this. And I focus primarily on the high elevation. Dr. Spidell will talk about some of the more moderate elevation research that we've got going. And so I guess we're going to take questions during the panel, so we'll go for there.